And we didn't.
All right, let's move on to the big issue of the day, which clearly is health care reform. As we're having this conversation, we don't know yet what the House is going to do, but it appears they are probably going to pass a health care reform bill, a version of the Senate bill. You had a television town meeting this week with Congressman Paul Ryan, who is a physician. And in the course of that, he said, no mistake about it, this is government takeover of the American healthcare system. Do you agree with that?
I do, but beyond that, not only is it a takeover and a hyperactive involvement of government in healthcare, it's something we can't afford. You know, one of the things that I think is most offensive about this whole debate is the false premises upon which it's built.
What are they?
Well, the very cost of it. They're saying the Congressional Budget Office saying it only costs X amount of dollars, but they're basing it on, there's two things that they're saying. Number one, they're basing it on the so-called doc fix, which basically means that the Congress is going to have to pass or approve legislation or action that would cut the reimbursement rates to doctors. Well, everyone in Washington knows that they're not going to do that, because if they did that, doctors wouldn't participate in Medicare. So that's going to add money to this. The other thing they're not telling you is this plan is 10 years worth of taxes, but only 6 years worth of services. For the first 4 years of this plan, they're already taxing you, but they're not even offering you the benefits.
It begins in 2013, I believe, is when it...
So when you analyze it, counting just those two things and some other things that should be counted, this is actually a $2 trillion deficit spending plan. It will grow our deficit, not shrink it.
So the CBO estimate that it's going to reduce the budget deficit by $138 billion, is that just so much hot air?
No, the CBO can only give you an estimate based on the information that they're provided. Their output is only going to be as good as the input, and the input they're being given is faulty. The input they're being given is that this doc fix is going to pass when everyone knows it isn't. Well,
but we know that Congress every year extends the, does not enforce, in fact, that provision. They've had that in the past.
If you didn't include that provision, then that number wouldn't be what it is for the CBO.
I understand. Let me ask you about the larger issue. 46 million Americans have no health insurance at all, and millions more are underinsured if they have any. And here in Miami-Dade County, I know there are about 600,000 people who go to Jackson, and there are a couple 100,000 in Broward County as well. Would not a health care reform bill help them and help the institutions that provide medical care? A health care reform bill would be necessary for America, and I'm in favor of a health care reform bill. I'm not in favor of this health care reform bill. Well, what would be the features of the bill? Well, the bill exists. It's called the Coburn-Ryan bill. Senator Coburn and Representative Ryan, Congressman Ryan, and the bill has a number of features. It allows for associated plans. It actually allows for small businesses to get together with other small businesses and create their own risk pool. It creates the same benefit for individuals that businesses now get, so that you can go out and get a tax benefit for buying your own insurance. It allows employers insurance across state lines. That's part of the associated plans. It's also part of the benefit that would be available to individuals. It includes meaningful tort reform and lawsuit abuse reform, which drives up the cost of health care. That's not part of this bill. It also includes, by the way, the ability for states to create, high risk pools and things of this nature that will allow for those people who have trouble getting insurance to get that insurance. There are alternatives out there. And how about the fact that, pre-existing conditions? That is a huge issue that has to be addressed. Does the Coburn bill do that? Not only does it address the issue, it also addresses the issue potentially of having high-risk pools, which would help with many people that have chronic conditions and are difficult to insure, and it allows you to do that through the states. And it's a better way of handling it than this massive $2 trillion deficit spending plan that America can't afford, and quite frankly is an overreach by government. All right, want to come back, ask about the big Everglades sugar purchase plan, talk about guns, talk about other things. We have more issues to talk about, so stay with us. We'll be back with Marco Rubio in just a minute.